Hi everyone, this is Dr. John Yim from VitaCare. I'm here with clinic nurse Chantal David and our two other doctors, Dr. Daniela Jesin and Dr. Carmen Luterbach. Most of you have been through some pretty trying, interesting times this week, and so have we at the clinic. Tuesday, we decided that it would be the last day that we'd be seeing patients face to face, and now we've closed the clinic. But I want you all to know that, we're not discontinuing care. We've decided that we'll be seeing patients by phone consultation, and we'll be doing video conferences for people that choose to connect that way. So I just want to talk to our doctors and Chantal for a moment, and just to get an idea how this past week has gone. So Chantal, you've had the privilege of contacting our patients to let them know that we're doing phone consults now. How's that been going?
Thanks, Dr. Yim. Yes, it's actually been a really smooth transition. People have been happy that we're able to offer this and happy that they can continue their program. So it's probably even a little bit easier for some folks because they don't have to drive anywhere. It's more convenient, possibly. So yeah, it's gone over nice and smoothly, and most folks are really feeling happy about it.
And Dr. Luterbach, you've actually done quite a few phone consults during this week, and I'm just wondering how it's gone for you.
Oh, hello. The phone consults have been really a great success. I think that I feel huge gratitude towards the patients. In fact, I mean, everyone's been so lovely and patient and kind. And honestly, I think that's been amazing. And I also feel that I hope people who need our care do see that in a phone consult, there is a high level of connection. And this coming week, we hope to have some more FaceTime like this so we can see each other's expressions, because that's pretty valuable too.
That's great. So I know that some patients might be wondering how to get hold of their supplements and refills. And I think that, talking to each individual doctor when you make your phone consults or video conferencing, you can arrange for that. One thing that Dr. Jesin and I have been doing this past week, we've been using a service called Full Script. And basically, the doctors figure out the prescription for the patients, and we email it to a company called Full Script. And then Full Script contacts the patient, emails them, and then the patient, if they agree that that's what they want, they pay for it by credit card. And in Full Script, they actually deliver the products to their door. So Dr. Jesin, you've actually used Full Script and had products delivered to you. Tell me, how does that service work? And just explain that a little bit to the patients, how easy that is.
Absolutely. Thanks so much, Dr. Yim. Hi, everyone. Yeah, Full Script is a really great service, especially in this time. It's really easy to use. When your doctor sends you a prescription, you'll get an email and it'll say, Dr. Yim, Dr. Jesin, or Dr. Luterbach, whoever your naturopathic physician is, has sent you a prescription. All you have to do is click on the link, fill out just some brief information so that the company knows where to send your products, and then poof, in a couple days, you get your products right at your door. It's really no hassle, and it's pretty easy and quick too, which is important. So I'm really grateful that we have that ability to use that service, especially now when we're trying to really limit contact and keep with self-isolation. So it's been working really great so far.
Well, that's great, Dr. Jesin. So for you patients out there and people watching this, one of the things our clinic aims to do is to keep in contact, because with social isolation, sometimes we feel out of touch with other people. And our clinic feels that this format is a great way for our doctors to get, keep in contact with patients and also give information, any helpful tidbits that we can give. And on that note, the two doctors and Chantal have some information that they'd like to share. And I'd like to start by having Chantal talk a little bit about the best way to do hand washing. Can you share that with us, Chantal?
Hi, I know many of you are doing your best to stay at home and self-isolate. There's a lot of other folks that are having to be outside the home because they're working in sort of essential services and food, grocery stores. So I wanted to talk about hand washing. So one of the most basic fundamentals of nursing, hand hygiene. So the biggest thing is to make sure you are lathering and washing for about 30 seconds. You want to make sure you're covering all surfaces of your hands, including the backs of your hands, your palms, in between your fingers, your fingertips. If you have longer fingernails, make sure you get underneath your fingernails. The other thing is to make sure you completely rinse off all the soap, because if you leave some of the soap on and your hands start to become dry, when you have dry skin, that's a spot where some of the germs can kind of stay in there. So we want to keep our hands exfoliated and moisturized as well. And then, so making sure we're practicing hand washing regularly. The second best method, if you're out and about and you don't have access to a sink, is to use hand sanitizer. Now, I know a lot of the stores have been bought out of hand sanitizer, but it is so simple to make your own at home. So what you can do is grab some rubbing alcohol. So it's going to have to be about 99%, or this one's 95%. And you're going to take 2 parts of that and mix it with some aloe vera gel. Or if you don't have any of that at home, I didn't have any at home, I just use some regular lotion as a medium. You just need to make sure that your end product is at least 60% alcohol. I also added, you can add 5 to 10 drops of an essential oil. I like to use thieves, and but whatever you prefer for your scent, maybe 5 to 10 drops of that. And also, when you're out and about, don't hesitate to, if you're going to the gas station, don't hesitate to use gloves, because you know those nozzles for the gas, to fill up your gas, they're just totally dirty and disgusting and probably never get cleaned. So bring your gloves with you if you can when you're out and about, but certainly as soon as you get home, wash those hands off. Back to you, Dr. Yim.
Thanks, Danielle. That was really informative. Now, our next speaker, Dr. Jesin, would like to share some ideas about staying connected. So, Dr. Jesin.
Hi guys. Yeah, so I'm thinking of what I want to share today. I just wanted to reflect on how my last few days have been while really sticking to self-isolation. And you know, like the word self-isolation implies, it can feel quite isolating and lonely. We're human beings, we're social beings, and a big part of our mental health and our well-being and our immune system is, you know, around connecting with others. So I'm so grateful that we have this platform like video conference and phone calls to be able to connect and stay connected with our patients, and really look forward to continuing to connect with everyone over these next few weeks. But I would just say, do use these tools and use these technologies to continue to reach out to your friends and your family, and try to stay connected, because it's so important and can make a world of a difference in just how we're feeling in terms of our well-being. So I would say that is my number 1 tip so far for today. Yeah, back to you, Dr. Yim.
Thanks, Dr. Jesin. Now, in these times, you know, it's natural for us to have a lot of anxiety and, you know, feeling stressed and maybe even a little depressed. So Dr. Luterbach is going to share with us a very simple technique on how to deal with that. Dr. Luterbach?
Thank you, Dr. Yim. Hi there. Just a moment, Dr. Yim, am I enlarged on the screen?
Yeah.
Okay.
Right to your neck.
It's not showing up. Okay. Thank you so much. I just wanted to speak to the greater kind of community of Vancouver Island and speak to the fact that this is a really vulnerable time, and it's something that none of us probably have ever experienced before. And I think that there's also a roller coaster of emotions, and I think that's natural too. And so when you're feeling overwhelmed and when you're feeling overcome, I think it's important to use that energy in a certain way. Maybe you want to write that down, or you want to call a friend, or you want to call a family member, or maybe a neighbor. And we just want to make sure we're emphasizing that as a larger community, we're all connected and we're in this together. And the more you can share and the more we can empathize with each other, the deeper these connections are going to be. So I have an exercise that I've used for myself when I've been overwhelmed, and I've used it a little bit in the last week. And I've also educated a few patients who have some triggers around health anxiety. It's about to be a difficult time for folks with mental illness, and every one of us. So we have to keep connected in a way that you can do this in your own little pod, in your own self-isolation pod, is practicing it together, or you can do it on your own. And I ask all 5 of us here to please do this together, if you guys don't mind. So there's some acupuncture points that are really well studied on helping switch your brain from the fight and flight mode into the parasympathetic, the rest and digest and be in the present moment mode. So I'm going to just outline these points with my fingernail. Oh, sorry, that's the second point. So I'm going to start again. Here we go. On this part of your pinky side of your finger, 2 ends of your eyebrows. Follow your eyebrows down 2 parts of your temples, cheekbone, below your nose, under your mouth, using your pinky side of your finger to use these points under your collarbone. And a little bit, I'm going to tilt this a little bit, and then doing points underneath your armpit with the pinky side of your finger here. So when we do this exercise, I'm going to go through it one time with the positions, but I really ask that you use a phrase that makes sense for you. And this technique is called emotional freedom technique. And I like the website, thetappingsolution.com. I think that's a really good intro. There will also be some videos and diagrams on that site. So you're going to take a phrase like, even though I'm feeling blank, I know that I am blank. For me, my 2 is always, even though I'm feeling overwhelmed, I know that I am safe. We gain tremendous power by teaching our body that we're safe and we're not at an acute threat, that we're not in a life or death situation, which is sort of what a lot of our nervous systems are thinking most of the day right now. So we're just teaching our body that here I am in my daughter's room, I'm sitting on a bed, I'm safe, there's no immediate harm. So when you do these points, and I'm going to go through them all in a sequence, but I'd like you to say that statement when you do it on your own for each of these positions. So I'm going to go ahead and go through the positions, and then I would be tapping. So with big deep breaths here, people. So even though I'm feeling overwhelmed, I know that I am safe. Even though I'm feeling overwhelmed, I know that I am safe. Even though I'm feeling overwhelmed, I know that I am safe. Even though I'm feeling overwhelmed, I know that I am safe. Even though I'm feeling overwhelmed, I know that I am safe. Even though I'm feeling overwhelmed, I know I am safe. This one's the best one. Even though I'm feeling overwhelmed, I know I am safe. Even though I'm feeling overwhelmed, I know I am safe. And a bonus that I forgot to tell you about, top of the head. I know I am safe. Okay. Thank you so much. My heart goes out to everyone. Thank you, Dr. Yim.
Thanks for sharing that, Dr. Luterbach. So again, I want to emphasize to all our watchers out there that VitaCare, our nurse and our doctors really care for our patients. And in these times where there's so much uncertainty ahead, we want you all to continue working on your health, because what we know for sure is that the healthier we are, the better we'll be able to withstand any infection. So any program that you've started with your doctors, I encourage you to continue. Don't feel that this is the time to give up and take a break from the program. With phone contacts and video conferencing, you can keep touch with your provider here, your doctor here, and we can keep your momentum going on your journey to health. So in the days ahead, if you need our help, remember, just call 250-755-5775. And if you call the clinic and you get this recording, it's my wife's cell phone number, and we'll be making phone appointments. We can arrange video conferencing. And I think I got the number wrong, so I'm going to give it again. It's 250-755-6775. Yeah, in this lighting, you can't see me blushing, but I'm a little embarrassed that I couldn't remember my wife's her cell phone number. But when you're feeling a little bit stressed, you forget things, right? So thanks for watching this, and I hope you keep us in mind, because we have you in our minds, in our hearts as well. So keep an eye out, because over this time, Chantal and the doctors and I will continue to get together to do these little video vignettes to get information and keep touch with you people out there. So thanks again for watching, and we'll be in touch. Good night now.